Often, our patients and clients' chronic disease challenges are not improving or are recurring because of underlying root causes and mediators we're not finding because we're not looking for them. The functional medicine lens compels us to cast a broad net in looking for the specific root causes and exacerbating effects of chronic disease in this unique individual, whether we're talking about asthma, chronic allergy, autoimmune disease, or type 2 diabetes, metabolic disease, or perhaps infertility or chronic fatigue. We have to cast a broad net and think about the interconnectedness of factors that we might be overlooking. Today, I want to tell you about 4 areas that we see here at the School of Applied Functional Medicine are often overlooked by practitioners as they start to learn more about the functional medicine lens. So please stick with me for all 4 of them, and especially the 4th one, because it is very often overlooked. Welcome to Functional Medicine for Real World Impact, where we're diving into the complex, interconnected nature of health and disease, exploring not just theory, but practically what it takes to turn functional medicine insight into powerful, practical, real-world results. So please hit subscribe and let's get started. But let's dive in. The first dynamic I want to talk about is the gut. And if you're familiar with functional medicine at all, you know that the gut, the gastrointestinal tract, is a darling of the functional medicine lens, because indeed so much of chronic disease begins in the gut or is exacerbated there. And it's natural for any of us to look to the gut if our client is wrestling with an obvious gut dysfunction, whether it's irritable bowel or chronic acid reflux or dyspepsia or constipation, diarrhea. Of course, we look in the gut. But many practitioners don't think to look for key root causes and mediators of anxiety and depression in the gut, or type 2 diabetes or hyperinsulinemia in the gut. Or what about immune hypervigilance or immune dysregulation, like any of the common chronic autoimmune dynamics that your patients can wrestle with? These and so many more often have key drivers in the gut. So let's talk about just a few actually of the many factors that can be at play in the gut. And the first one is short and sweet, but often overlooked, and it has to do with the ho-hum arena of digestion. I've done a totally separate video on this particular topic because it's so important. We often assume that just because we eat food that's laden with micronutrients, that nutrition is going to get into our cells where it's needed to support our tissues. And nothing could be further from the truth. For many reasons, individuals in your practice are not getting the nutrition that they need for optimal functioning simply because we're not well breaking down that food and isolating individual nutrients in order to allow them to be well absorbed into systemic circulation and therefore available for uptake by our cells. And whether it's people in your practice who have chronic acid reflux and are taking proton pump inhibitors, or patients in your practice who have type 2 diabetes and have impaired digestive enzyme secretion from their pancreas as well, or maybe your patients who have hypothyroidism, who have poor gallbladder function. These and many more can overtly contribute to not a small amount, but a gross impairment in digestion of nutrients. And we are simply not going to be able to bring on board the amino acids, the essential fats, the minerals, et cetera, that we need in order to help the brain to thrive so that we have good mood balance and stability, or to help our immune system to thrive with good pro-inflammatory, anti-inflammatory balance so we don't struggle as much, for example, with pain syndromes or chronic inflammatory dysfunction like arthritis. We need minerals to fuel the vast majority of enzymes in the body, for example, to support our antioxidant synthesis, to help us counter all of the pro-oxidant load that our modern lifestyle choices put on the body. So we don't want to overlook the criticality of digestion and simply questioning whether or not there is an impairment in someone that we are supporting. If you'd like to know more about that, be sure to check the separate video that does a deep dive into we are not what we eat. But today I want to emphasize in particular the role of the gut in creating good immune regulatory balance. We don't often think about immune function originating in the gut, but indeed, the vast majority of our immune cells do reside in the gut. And courtesy largely of our highly diverse microbiome, this is where our immune system is being primed and educated largely about the status of our world. There's a huge amount of afferent neurotransmission that goes from the gut to the brain in order to inform the brain about the status of our gut and how we can best respond in order to help us to thrive. But of course, we do a lot of things in modern life that can set us up for imbalance in our microbiome, and not the least of which is the very frequent intake of antibiotics. And indeed, these medications are blessings. Sometimes they're absolutely critical for killing off a pathogen that is promoting a notable threat to a physiological system, or maybe even life-threatening. But antibiotics are obviously not just wiping out pathogens, they are also wiping out a tremendous number of commensal and facultative bacterial populations as well. And when we have a dearth of powerful commensals or regulatory species in our microbiome, we are much more likely to struggle with immune dysregulation, especially developing an immune system that's not appropriately primed for tolerance and is much more likely to become hypervigilant and overreactive and perhaps losing tolerance of self. And so we want to pay attention to all of the things that we might do that might keep our microbiome from thriving. And that's not just a matter of killing off our microbial friends with antibiotics. We can carry out the same thing even with antimicrobial herbs that individuals might keep taking for prolonged periods of time without understanding the negative effects. Of course, we consume all sorts of chemical-laden foods, pesticides, herbicides, fungicides, that also will have antibiotic types of effects in our microbiome, in our guts. And so we want to think about immune regulation beginning there. But even if we have a good balance and diversity of microbes, we need to feed them. And this is where nutrition is so critical. And I want to talk about this piece in particular because right now, the ketogenic diet, very low carb diets are really quite popular, and for valid reasons in terms of helping individuals to reduce their glycemic load and to improve their metabolic function. But like every other type of dietary pattern or approach to nutrition, there are people for whom it is a great fit and people for whom it will be disease exacerbating. And it's important to remember that our microbiome thrives on phytonutrients from plant foods and also from different types of fiber and resistant starches in order to help them to be fueled and to remain a key component of a diverse microbiome. And so plant foods are really essential for supporting a good, healthy microbiome. And in fact, one of the biggest risks of a ketogenic type of diet that might step away from the vast majority of plant foods, even low glycemic plant foods, is that our microbial friends start to make fewer and fewer short chain fatty acids. Our many bacterial species are taking in this residue from our diet especially again, different types of fiber and resistant starches, and also the huge diversity of phytonutrients that we bring on board from our foods, categorized in part by the colors that they present in the fruit or the vegetable, for example. The phytonutrients that are present in orange vegetables versus yellow fruits versus red ones are really quite different, and we need a nice diversity of them. There's actually a lot of nutrition wisdom in the simple adage of we should eat from the rainbow in terms of bringing on board a diversity of phytonutrients. But we need to bring on board these foods, and certainly we can vary the glycemic load of our plant food intake. But following a ketogenic diet that largely discards carbohydrate foods can really lead to a threat, a dietary threat to our microbiome. And so something to consider with regard to crafting a custom diet for the people that you're supporting that helps them to understand some of the nuances that they don't want to unknowingly miss and set up a whole secondary disease dynamic in pursuit of better metabolic function. But the third thing I want to talk about the gut is perhaps the item that is most often overlooked. And this has to do with the criticality of gut barrier function. Inside the body, we have all sorts of fascinating physiological systems that are indeed interconnected. The gut affects the brain affects the heart affects the kidneys affect the liver affects lymph and circulation and hormones. Everything is interconnected. We are always going to make a mistake by just myopically focusing on a single physiological system. We always have to consider the whole when considering the health of any one individual component, whether it's a specific gland or organ or an entire system that might be challenged or dysfunctional in a given person. But in order to create harmony in the body, we rely on barriers, on tissue barriers that throughout the body are largely semi-permeable. So for example, the intestinal barrier we need to be appropriately permeable because of course we need nutrition to come in to the systemic body via the intestinal lining, right? We want to get the good stuff in. And we also need to be able to move toxins out of the body, move waste products out of the body. And so we need well-controlled inflow and outflow. And a dynamic that is promoting systemic inflammation in many of your patients is a loss of barrier function. This means that excessive amounts of debris, for example, from the gut, are able to get down into the basement membrane of the intestines and trigger a much more aggressive immune response there. We have our gut-associated lymphatic tissue or GALT down in that basement membrane of the intestines. And this is well thought of as our immune police station, and our immune systems can become much more aggressively reactive to what is in the gut as we start to lose that mucosal protection, that mucosal integrity in the lining of the intestines. But in many cases, your patient's loss of barrier function even goes beyond that, where the tightly controlled tight junctions lining the intestines have begun to become more and more permeable, creating bigger gaps where all sorts of pro-inflammatory debris from the gut is actually able to make it into systemic circulation. And the inflammation that might be causing your patient's mood imbalance or cognitive dysfunction, or the inflammation that might be promoting joint pain and swelling, or the inflammation that might be manifesting on the skin as eczema or psoriasis, for example, might have its origins in the gut, where pro-inflammatory debris from our microbiome, from our gut, has not been retained there, but it has been able to gain systemic circulation because of loss of barrier function. And this affects many more people in your practice than you might realize. And part of this is because there are many common medications, for example, that overtly increase intestinal permeability, overtly impair that barrier function in the gut. And these are everyday things such as ibuprofen or steroids or oral contraceptive pills, right? Any type of oral estrogen, for example, is known to increase intestinal permeability. And when we go from having good tight junctions to having much greater permeability, where partially digested food fodder or debris from our microbial friends can get into systemic circulation, the immune system becomes very reactive to this debris, and in particular to lipopolysaccharide or other forms of endotoxin that do not belong largely in the systemic body. The immune system tolerates large amounts of it in the gut, but can become very reactive to it when it is increased systemically in terms of promoting higher levels of inflammation. But we don't often think about gut barrier function. Low vitamin D, inadequate levels of zinc, for example, can also promote that loss of tight junctions. What about things like histamine overload? Lots of individuals in your practice, especially in the days of long COVID and post-COVID, are struggling with histamine overload. It's also a common functional imbalance in perimenopausal women because of the role of sex hormones in regulating histamine balance, for example. But histamine overload in the intestines will also increase permeability of the intestines. So we want to be on the lookout for these dynamics. And you can really learn to master these root causes of gut dysfunction that might be promoting your patient's brain fog, might be promoting their rosacea, might be promoting their infertility, might be promoting their type 2 diabetes, promoting their lupus, promoting their asthma. So much of disease does indeed begin in the gut. So regardless of your expertise area, you want to learn to master the gut and always look there for root causes and mediators of other localized disease that may feel far distant from the gut in terms of space, actual distance. But biochemically, there's a very strong connection between the gut and everything else in the body. The second item I want to talk about is the nervous system and the importance of having good sympathetic, parasympathetic balance. Because many people today in our practices are struggling with an imbalance in their autonomic nervous system. And indeed, in our typical Western American culture, where we tend to be very focused on go, do more, better, faster now, we are in general a very stressed population. Our jobs are stressful, our families are stressful, our home environments are stressful, our relationships are stressful, and perhaps most insidiously, our self-talk is stressful. It's often super critical and negative and even downright mean and dismissive. All of these environments, all of these different types of stressors collectively inform our nervous system about the status of our world. And there are many people in your practice who are making choices and have circumstances and an environment on a day-over-day basis that is naturally telling your physiology that your world is not safe. It's just not. And so the most appropriate immune system status is that of a sympathetic nervous system state, which promotes fighting, flighting, and frighting. right? We want to run, we want to defend ourselves, we want to freeze, we want to hide. And most people are not aware of the fact that they're in this nervous system state. They just think they're doing the best they can, navigating life on a day over day basis. But of course, this is a primal nervous system state that promotes survival, and it's essential for survival. The challenge is that in today's modern world, for many people, sympathetic nervous system state is not an episodic, short-term circumstance. It becomes more part of our norm. The human physiology is designed to thrive if we generally have more of a parasympathetic norm. In contrast to the fighting, flighting, frighting that comes with the sympathetic drive to survive, the parasympathetic axis of the nervous system is about resting, digesting, healing, reproducing, making babies, and thriving. And many people in your practice are making choices and having circumstances that are promoting a sympathetic nervous system norm, but they're frustrated because they want to have a parasympathetic nervous system experience. They're telling their body with all of the different aspects of their life that survival is not assured and that we need greater protection and we need to be largely in this fight and flight mode. But that promotes a set of responses in the body that goes counter to the thriving that most people want to experience. Like I said, we have stressful relationships, we have stressful jobs, we have stressful thinking. We also have a lot of physiological stressors. We deal with oxidative overload and tissue damage. We have a lot of toxic stress, microbial or pathogenic stress. We have mitochondrial stress. We may have oxygenation stress, things like low-grade chronic anemia, or perhaps even more insidiously, sleep apnea. The kinds of things that folks are experiencing day over day and on an ongoing basis as part of their norm are acute stressors to the body and informing the nervous system, prioritizing physiology that's about surviving. And this naturally promotes higher blood sugar, higher blood pressure, a hypervigilance that naturally promotes worry and anxiety and insomnia, not because the body's broken, but because it helps to promote survival. It also the body will also be encouraged to store more fat as metabolic fuel against an uncertain future. But our choices are promoting that sympathetic response, but we want to have a parasympathetic experience, right? Folks want to feel good every day and high vitality and have great skin and eat anything they want and perfect bowel movements and good libido and orgasms and get pregnant whenever they wish and just have good resilient moods and everything rolls off my back and I'm relaxed and I'm not depressed and I'm not anxious and life is just happy-go-lucky, which is a parasympathetic reality. And individuals in your practice are struggling in large part because they do not understand. And in many cases, practitioners are not looking for the full basket of stressors. Again, not just emotional ones, but physical ones, physiological ones, environmental ones that are driving that strong sympathetic dominance. But it's also true that there are a number of factors in our lives today that can hinder parasympathetic response. And like everything else in the body, we use it or lose it. And we focus on that sometimes with regard to things like circulation and mobility of a joint or maintaining lean muscle mass for strength. But we actually have to exercise nerves also in order to maintain good neurotransmission. And this is true in all the nervous systems in the body. And there are a number of people in your practice who struggle with poor parasympathetic nervous system response because the dominant nerve that is accomplishing it in the body, the vagus nerve, is not working optimally. We have poor vagal neurotransmission. And there are many reasons why this might be the case, and you can really study this and learn to master all of them. But today in particular, I want to talk about the role of COVID in this particular dynamic, because autonomic neuropathy is a common functional imbalance or disease dynamic that you're going to see in a lot of your patients, especially those with any degree of long COVID or post-COVID suffering. And so we want to be considering whether or not an individual has a complement of habits or behaviors that are actively training and keeping fit the vagus nerve. And because the vagal transmission is about the relaxation response, right? That rest, digest, heal, reproduce, thrive. It requires that we create space in our lives where we are activating a parasympathetic response on purpose. But this is not remotely a cultural norm in the vast majority of our communities. We may only do that type of thing when we go on vacation, right? And we have a lot of critical language for people who might activate resting and leisure on purpose. Culturally, we might discourage that behavior in an insidious way by referring to those people as being lazy or unmotivated or not driven or on the fence. People who are simply trying to cultivate a more balanced, relaxed activities in their lives as a way of telling their nervous system that their world is safe, their world is secure. And so the body in its wisdom can risk being in a parasympathetic state because our survival is guaranteed. It's in a good place because the body is always going to prioritize ensuring survival before it will put a focus on promoting thriving or healing. And often what is at play in your patients who improve in a chronic disease dynamic, but they just can't fully get on top of it, or there's frequent recurrence, is that they're not able to spend enough time in a parasympathetic nervous system state. Part of that is behavioral and doing things such as mindful breathing that has long, slow exhalations. That would be virtually impossible if you were running for your life and in a threatened mode. We also achieve this parasympathetic activation when we're doing more nurturing types of movement like yoga or Tai Chi or long walks, right? Less focused on trying to stimulate our cardiovascular fitness, but more focused on simply trying to move the body, get some fresh air, lubricate our joints. And so we need to cultivate with patients practices that they can do on a regular basis in order to stimulate parasympathetic response. But we also need to make sure that their vagus nerve is healthy. And there are a lot of people in your practices who don't have optimal vagal transmission, in part because they have inadequate key nutrients that are needed for the nerves to thrive. Things like vitamin B12, which is essential for the synthesis and function of the myelin sheath that protects our nerves, or vitamin B6, which is an essential cofactor for the synthesis of the vast majority of our neurotransmitters. But also, again, what I mentioned earlier, we need to talk about COVID because autonomic neuropathy, due to lots of oxidative stress and damage from COVID disease, is a key part of causing that vagal dysfunction. And research shows that there's a bit of a double whammy here because spike protein can bind with the acetylcholine receptors that in the vagus nerve in order to impair that powerful parasympathetic neurotransmission. And parasympathetic response is not just about relaxing the body and sleeping well and having good digestion. You also want to think about vagal transmission and the possibility of poor parasympathetic response in your patients who seem stuck in a pro-inflammatory dynamic. And this is true for a lot of long COVID patients, where the cognitive dysfunction, the heaviness in the limbs, or joint pain, muscle pain is persistent, and they just don't seem to be fully recovering, even though their experience with the COVID viral disease or with an mRNA vaccination may have been a while ago. But the body is staying in more of a pro-inflammatory dominant state, in part because the vagus nerve is a key component of immune balance. And even for those of you who are very skilled in understanding the functional medicine lens, we don't often think about the vagus nerve playing a key role in immune function. But it's actually through that parasympathetic transmission that we stimulate a strong anti-inflammatory response, right? We want to have a good, aggressive immune system that when there is a threat, it responds quickly, incisively, and in a targeted way. But we also want to have a ready at hand anti-inflammatory brake so that that pro-inflammatory fire doesn't end up causing a tremendous amount of tissue damage and dysfunction, which is unfortunately a hallmark of a lot of these long COVID cases. And so promoting more of that anti-inflammatory response is actually a critical function of the vagus nerve. And it's carried out primarily via these acetylcholine receptors and orchestrated actually primarily via the spleen, which is a tissue we don't talk about very much, especially in later adulthood. But having that good neurotransmission via the vagus nerve to the spleen is really critical for that anti-inflammatory break. And in fact, a lot of the things that you might be hearing about in terms of more progressive therapies in order to help to ease that pro-inflammatory bias in long COVID patients, like nicotine patches, hinges on the power of different chemicals like nicotine in order to trigger those acetylcholine receptors in order to have that calming, more balancing effect on our immune system to quell so much inflammation. But there's a number of different things that can accomplish that same triggering and health of parasympathetic neurotransmission. And again, this is an area of functional physiology that I think all practitioners should really master, because there is no healing. There is no healing in any sustainable way when we are in a sympathetic dominant nervous system state. There just isn't. And part of the challenge with long-term or recurrent disease is that as individuals are starting to heal from a disease dynamic and they feel 50% better, 2/3 better, they often are so quick to jump right back into the life environment that promoted them getting sick in the first place. We're not taking time and creating space to fully get well before we jump back into really challenging and often very stressful environments. And individuals in our practices will often say, yeah, I have a lot of stress, but it's okay, I'm handling it. But the fact that we feel like we're handling it does not at all take away from the fact that the body is wise and keen and fully noting that our lives are very stressful, and it's not keeping us from being in a sympathetic dominant state. We may feel like we're surfing it well, but the body is going to choose a very different set of neurotransmission, muscle contractions, hormone levels, if it believes the primary thing it needs to focus on is surviving versus what it will promote physiologically if it believes it is safe to actually prioritize helping us to heal and thrive. What this means is that behaviors that trigger that parasympathetic response are critical, scientifically anchored behaviors that we often overlook or ignore because they seem way too simple to be of any physiological value or scientific credence at all. We don't often think about things like just relaxing in nature, or spending snuggle time with loved ones, or petting your beloved dog, or singing, laughing, gargling, humming, yodeling. Again, as I mentioned earlier, yoga, Tai Chi. There are so many simple, accessible activities. Mindful breathing, box breathing. There are many different types of breathing that are parasympathetic activating. They're so simple that your patients have a really hard time believing they can matter that much, often because practitioners have a really hard time believing that any of that could matter that much. But research tells the truth that these are super powerful tools. And rather than discarding them because they're simple, I think we have a powerful opportunity to embrace them and be grateful because they're free and they are easy to implement. They are easy to make habits in our day-to-day lives to help promote that parasympathetic nervous system state, which is the only place from which healing actually happens. So the third thing that I want to talk about today, 3 of 4, is about labs. So shifting from patient behaviors to practitioner behaviors and practices, the functional medicine lens compels all of us to take a more careful look at lab data. Lab data is a wonderful gift, whether it's from everyday annual physical labs or more advanced functional labs, looking at a targeted system or source, root cause of dysfunction. But too often we are looking for normal reference ranges to tell us whether or not a lab value is worth spending any time on. And we're missing a huge number of red flags and wake up calls and ahas in lab data, because unless a value is clinically high or clinically low, we don't focus on it. We don't evaluate it. And it's important to remember that for the vast majority of markers, in the vast majority of our cultures, and I appreciate that our community is very diverse and global, and normal ranges or reference ranges are treated differently in different countries and in some cases via different labs. But at least here in the US, many of the normal ranges are simply statistical ranges. It's 2 standard deviations around a statistical norm that shows really the spectrum of what 95% of the normal population presents with. But in a culture where chronic disease is rampant, there's a tremendous amount of disease and dysfunction inside normal ranges. But we won't find that if we're not looking for it. And even beyond that, we tend to compartmentalize markers as being measurements of good stuff or bad stuff. And we tend to think, oh, bad stuff like inflammation, the lower the marker, the better. And good stuff like nutrients, the higher, the better. And sometimes that's true, sometimes that isn't true. We don't stop to think about even seemingly optimal lab values that don't make sense for that unique individual, given what else we know about them and their history and their current life system, their current environment. So we're not necessarily questioning why that lab data point might be completely misrepresentative of what is actually happening in their body, not because of a lab error, but because, for example, all of the biochemicals we are measuring in labs have to be synthesized by the body. And in some cases, we have lower levels of a given biochemical, not because that's what the body wants to synthesize or what we would normally see expressed, for example, in blood. We're seeing lower levels because the body doesn't have enough of the key cofactors needed to make that biochemical. And so we see lower levels. And a great example of this is liver enzymes, liver function test, ALT, AST, for example. Many times we see in lab data in the cases that we review at SAFM, single digit ALT and AST levels, right? And keep in mind that these are enzymes that we are seeing, we commonly measure in labs, that are really a marker of the level of enzymes that the liver is expressing, and especially with AST, other tissues as well, in order largely to heal that tissue. Right? It's not actually a marker of health. It is a marker of how much is that tissue being turned over in order to heal and restore itself. And high levels tell us that that tissue is being very challenged and it's having to turn over tissue a lot. But turning over tissue and supporting tissue restoration is actually a mark of health, a mark of restoration. However, these enzymes require nutrient cofactors for their synthesis, and both ALT and AST, for that matter, other similar markers for the hepatic biliary system like GGT, gamma glutamyl transferase, they require vitamin B6 as a cofactor. And if individuals have suboptimal levels or an insufficiency of a given cofactor nutrient, then their body is not going to be able to make as much of this biochemical as they might want. And this puts you in the situation of looking at, say, an ALT level that is in the first quartile of the normal range. And a lot of conventional providers would say, hey, great job, looks great, even though that person has type 2 diabetes. And so some degree of non-alcoholic fatty liver is a pretty good assumption. Even though that individual struggles with a high toxic load because of their, say, their work, commercial work environment, or known mycotoxicity or heavy metal toxicity in their environment. So we know the liver is going to be challenged, and it doesn't make sense that the liver would only need to be turning over and repairing itself less frequently than the average person. So this is where we always want to be considering, who is this person, and not ever looking at any factors about a case, much less lab data, through the lens of evaluating everyone in the same way. If I have challenges in my liver and I have insufficient vitamin B6, it's actually a double negative that my ALT levels are going to be low, because what it means is that my liver is likely not able to generate enough enzymes in order to restore tissue health as is actually needed. So we want to be thinking about, who is this person, and questioning lab values that don't make sense for a unique individual, and also consider where insufficient nutrition might be the reason why markers are surprisingly low. Another great example is alkaline phosphatase, which naturally spills into the blood from a few different tissues, like the liver and the biliary tree, and also the intestines and the bones. And we're used to seeing a moderate amount of it in the blood, which is good validation that the body is able to make enough, but we're not having excessive spillage into the blood that speaks to maybe a tissue damage or dysfunction. But sometimes you see people with notably low levels of alkaline phosphatase, right? Maybe in the bottom 15, 20% of the normal range, or even clinically low. Instead of celebrating that, we want to be thinking, for this unique person, why might they not be able to make enough alkaline phosphatase? And maybe the reason there's less spilling into the blood is because the body in general is constrained from making an optimal amount of it. And in fact, research shows that, in particular, insufficiency of zinc and or magnesium can impair alkaline phosphatase synthesis. And alkaline phosphatase is a critical enzyme. It plays a lot of different functions. In fact, coming back full circle with interconnectedness, I was speaking earlier about the powerful pro-inflammatory impact of lipopolysaccharide and other debris from our microbiome in the gut. Alkaline phosphatase in the gut is one of the biochemicals that helps us to break down lipopolysaccharide. So it's not as pro-inflammatory when the immune system encounters it, so that we're better able to break down a lot of that lipopolysaccharide in the gut and simply excrete it in our stool, so that we don't absorb as much of it into the systemic body that can promote greater inflammation. So we need a full complement of nutrition to be able to synthesize these biochemicals that are needed to optimal levels to fuel the body. And sometimes we're missing cues and clues in fairly everyday blood labs, because we're not questioning low values that just don't make sense for this person. On the other hand, sometimes we're not questioning higher values. We often assume that because of its reverse cholesterol transport function, that HDL, high density lipoprotein levels, the higher the better, right? Especially in a world where we tend to struggle with elevated levels of LDL. We want to have plenty of HDL in order to rescue us from this LDL burden. And indeed, that is part of the normal healthy function of HDL. But research shows that as higher levels of HDL are generated, it becomes dysfunctional and it actually begins to lose its capacity for reverse cholesterol transport and can actually begin to contribute to an atherosclerotic dynamic. So we should not be assuming that the higher the better levels of HDL, especially as men's levels get up into the upper 80s and 90s, or women's levels get up around 100 or even higher. It is highly likely that an atherosclerotic dynamic is being exacerbated by that HDL. Similarly, many of us support women in our practices, for example, who struggle with iron deficiency, in part because of heavy menstrual bleeding and blood loss during their menstruating years. And so we're looking to see that iron stores or ferritin is ample, and we tend to celebrate higher levels of ferritin. But it's also true that the body, in its own wisdom, is going to purposefully sequester more iron as an inflammatory protection mechanism. Ferritin is a wonderful inflammatory marker. In fact, it's much less labile than C-reactive protein, and it can be a great marker of seeing really elevated ferritin begin to come down as evidence that the body, in its wisdom, really believes that the pro-inflammatory threat has receded. And so if, for example, you're supporting a woman who has very heavy menstrual bleeding, she might be really struggling with estrogenic overload, and she has heavy PMS symptoms and a long, heavy blood flow during a menstrual cycle, but her ferritin is 100. We want to be questioning, this does not make sense for this unique person. And we want to at least question, is this actually a marker of systemic inflammation where the body is purposefully sequestering iron away from other functions in order to keep that iron from exacerbating inflammation? Iron is a critical nutrient, right? A critical mineral, but it's also the ultimate heavy metal. And iron can promote a very pro-oxidant environment, especially when it's in excess. And iron can overtly fuel the overgrowth and thriving of a number of different microbes, especially bacteria and different yeast and fungal species. And so in order to protect the body both from infectious challenges as well as other inflammatory dynamics where that strong pro-oxidant effect may damage tissue, the body will bind up more iron, and an individual may have an interesting dynamic where they have borderline iron deficiency anemia and looking at their hemoglobin, for example, but yet their ferritin is seemingly optimal, such as the case with the menstruating woman, or for a woman with more nominal menstrual cycles, her ferritin might be quite elevated, right? Might be 150, 200, in some cases much, much higher than that. And this is not because of a genetically mediated hemochromatosis type of dynamic. It's because the body in its wisdom is telling you that there is a pro-inflammatory dynamic here, and I'm not going to let loose this nutritional heavy metal until it is safe to do so. We tend to use high sensitivity CRP as a end-all be-all marker of inflammation, but CRP is quite labile, and levels tend to go down in the early stages of inflammation reduction that may not belie a sustainable disease regression. It may just be a slump after a flare of an ongoing disease dynamic. And so CRP can be misleading. Certainly it's an important marker to look at, and especially to look at over time with repetitive assessment. But sometimes ferritin is a much more stable, less labile, right? A little more cynical marker to let us know whether or not we're really getting at the roots of inflammation for this unique person, so that the body will more freely let a full complement of nutritional iron be available to support our bodies. We could talk about so many more examples for this, and you can actually learn to wrench a huge amount of value from fairly basic, everyday, often covered by insurance blood labs. A mistake we see a lot of practitioners make in using functional medicine in their practice is assuming that they need to go get this big basket of expensive functional labs for every patient they support. And for the vast majority of patients, that's simply not necessary. Often even absent labs entirely, there are plenty of qualitative aspects of the case that make crystal clear the functional imbalances that are at play and how we can begin to address them step by step. But even if we just have recent blood labs, we can tell an awful lot about what is at play in the body, and maybe using fewer, more targeted functional labs, especially later on in the clinical program, in order to get at the more insidious or more entrenched dynamics later on in the relationship, especially when a patient is starting to feel better and their belief and their healing journey is more galvanized, and they are more excited about, more ready, willing, and able to invest in some advanced labs in order to tell what is at play. The thing I want to leave you with is perhaps the most simple concept that I'm going to talk about today. And indeed, I could have chosen 30 different dynamics that we often miss. And I just chose 4 for you today. But one of them has to do with you and how you show up in clinical practice. And that is, we never learn the answers to questions we don't ask. And how often a key piece of information that your patient is really willing to tell you, we miss because we don't ask the question. And often your patient has key knowledge or insight or intuition or historical aspects of their life journey that they're not sharing with you, not because they're not willing to tell you, but simply because they don't know it matters. They don't know it matters. They have no idea about the interconnectedness of what is at play in their unique case of chronic disease unless you teach them. And this is where a deep, thorough intake session is critically important for success in really helping to step-by-step promote disease regression, not just relief, but regression in the people you support in your practice. But we also want to cultivate a constant beginner's mind of questioning through every single session you have with the patient. Always thinking through the lens of, what don't I know yet? What has not come to the surface? What am I missing? What additional puzzle pieces are at play? You know, when you're doing a jigsaw puzzle and you flip it out on the board and you're trying to put everything together and you just can't find that missing piece? It's really valuable sometimes to get down on the floor and look and question, okay, instead of searching endlessly from what I already know, let me have beginner's mind and see if there's a piece on the floor. Is there a piece under the table? Is there a piece stuck in the box? And having beginner's mind and asking your patient targeted questions can be so valuable. And at SAFM, we teach practitioners how to do this with immense capability and thoroughness, because it's a critical part of your clinical skills, completely separate from the science of functional medicine, but your clinical skills and how you apply it. But sometimes what we're not asking about is keeping hidden a really important factor. The number of patients who don't, for example, remember to tell you that they don't have a gallbladder because they've been told so long that the gallbladder is just a sac and it doesn't matter, and they had it out 15 years ago, and they've just been told repeatedly that is an optional body part. It is not optional at all, which is a subject for another video on a different day. But they're not going to tell you that they have had a cholecystectomy, maybe because you didn't ask. It's really important to say, are you missing any body parts at all that you were born with? Or do you have any body parts now that you weren't born with? It seems like a so simple, almost humorous question, but it's amazing what sometimes it will bring to light. Uh, it is important to ask people about over-the-counter medications. Often people will not think to tell you that they are using proton pump inhibitors because they freely went to the drugstore and bought them themselves. So they don't think the drug is that important. They don't think it matters. They don't think it could possibly have really disease promoting effects, which of course it can. Because most people's belief system is that if they can go freely get it, how dangerous could it possibly be? It's safe, right? That's why I can go buy as much as I want. The same is true if people are using calcium carbonate tablets for relief from acid reflux or indigestion, or ibuprofen or acetaminophen. All sorts of over-the-counter medications that people will not think to mention to you unless you specifically ask. A really insidious one is women who do not think necessarily to tell you that they are using birth control pills. Well, I had a woman one time explain to me, after I finally learned 3 months into our partnership, that she had been taking birth control pills for decades. She said, "Is that really a drug? I mean, it's really just a method of birth control, right?" And I've learned over the years that a lot of people think about it in this way, and they won't necessarily tell you about it. But learning about birth control pills is massive in terms of a source of oral estrogen that can be a major contributor to enhanced intestinal permeability. It can contribute to damage and dysfunction in the liver. It can be promoting hypertension. It can be creating histamine overload in the gut and in the systemic body. We need to know when someone is using oral contraceptive pills. We also want to ask about childhood, prior life experiences, in particular, prior toxic experiences. And this can be anything from growing up on a conventional farm and running through the fields that were sprayed with conventional agricultural chemicals with its gross endocrine disrupting effects and toxicity. It may involve toxic emotional environments, especially up to the age of 7, which research shows can be very powerful in priming a hyper responsive amygdala later in life, even decades later in life, in terms of promoting that hair-triggered sympathetic nervous system mode that promotes worry and anxiety and hypervigilance and often leads to insomnia. These are things we definitely want to understand in casting a broad net through the functional medicine lens. Oh, if people tell you on their intake form that they currently have 6 mercury amalgam fillings in their mouth, we want to ask, did you used to have more? Have you had some of them removed? Because sometimes people will say, no, I've only ever had 6 and I still have them. I had a client many years ago who said, oh, no, I used to have 16. I've had 10 of them removed. Really notably and not surprisingly, in the year before they developed a chronic autoimmune disease. These are things that we can't find unless we are looking for the dynamics. We want to ask about a current living environment, and toxicity is a wonderful thing to have a checklist for. Mold, hypervigilance and toxicity is becoming incredibly rampant in our practices. And I think on the other side of a lot of the immune dysregulation that's happening with long COVID and post-COVID, people are becoming even more sensitive to this, because it's one thing to live in an environment where you're exposed to mold on a regular basis, and it's promoting that chronic immune reactivity that is stimulating inflammation. It's promoting a sympathetic nervous system state. It is increasing histamine synthesis, right? All of this is evidence of that hypervigilant immune function. But sometimes people could have left a moldy living environment or working environment behind months or even years ago, but they still struggle internally with retained mycotoxicity, which is separate from the the immediate immune challenges of the mold itself, but the resilient mycotoxicity can have all sorts of different negative effects on the body. In particular, it can be immunosuppressive and obviously set the stage for other types of opportunistic overgrowths and infectious challenges. So I could go on. And at SAFM, one of the ways we train our practitioners to become very confident and resilient in optimizing their clinical practice is with continuous real live complex case mentoring, where we go through all of this nitty gritty devil in the detail and nuances of case assessment and case intake and interventional planning and course correction when it's not working. These are critical clinical skills that you too can learn to master. So I want to thank you for joining me today. There's so many other components we could have discussed, but to recap briefly, never forget the gut. It is where the vast majority of chronic disease either originates or is being exacerbated, perhaps in a hidden fashion. Number two, don't forget the critical role of parasympathetic neurotransmission, especially via the vagus nerve, in promoting any and all healing. Any and all disease resolution, it's not optional. That requires healthy nerves, a healthy vagus nerve itself that's well trained, but it also assumes a good nervous function that's being triggered by our behavior. So we have to prioritize an environment for healing. Number three, we want to look at available lab data with a more careful, keen, discerning eye and get out from under very quick, it's either high or low or it's fine. Or good things should always be high and bad things should always be low, because we're missing a veritable treasure trove of data insights that could help us to support patients to get better clinical outcomes. And then lastly, number four, we can't find what we don't look for, and we're not going to learn nuances that we don't ask about. So trying to cultivate that beginner's mind to make sure that you're learning everything you need to know about this unique individual, to make sure you're not missing critical nuances that they simply have not yet told you about. So thank you so much for joining me. I wish you the best of growth and maturity in your clinical practice, and I look forward to being with you next time. Have a great day.